Thank you all for a wonderful day of sessions, and I would like to ask you to join me in welcoming the Honorable Norihisa Tamura, the Minister of Health, Labor, and Welfare of Japan.
Excellencies, ministers, distinguished guests, ladies and gentlemen, thank you for coming to the Global Conference on Universal Health Coverage for Inclusive and Sustainable Growth, co-hosted by Japan and the World Bank. Allow me to say a few words in closing this conference. The government of Japan and the World Bank had embarked upon a partnership program covering 11 countries, including Japan and mainly low and middle income countries, in order to seek the possibility of applying to the developed countries the know-how and expertise on UHC of Japan based upon our experience on universal health insurance and other health-related measures. And in order to stocktake the research activities conducted in the past 2 years under the objective of sharing challenges and expertise as well as experiences of UHC of various countries and to disseminate the know-how and experience of Japan, with the participation of President Kim of the World Bank, health ministers of developing nations, Director General of the WHO, representatives of global organizations, international organizations, academia, and NGO. We were able to host this global conference on universal health coverage for inclusive and sustainable growth. And we find extremely useful that such productive discussion had been conducted. In 1961, Japan realized the universal health insurance system. 53 years ago, we established a system where each and every citizen would subscribe to some kind of public health insurance system and to enable the access to health care through certain level of copayment. And through such health-related policies, Japan has been able to achieve the highest longevity as well as extremely high level of healthcare services. However, 50 years have passed since, and we are currently faced with dwindling birth rate and sharp rise of aging and prolonged economic recession, and therefore the socioeconomic environment has transformed greatly, and once again we are reminded of the difficulty of health finance. And under such circumstances, we are taking various measures in order to sustain the universal health insurance system, which is the basis of peace of mind and security of the people of Japan, and to ensure equitable, gapless healthcare service, both in terms of volume as well as quality. Universal insurance system, which is a pillar of UHC, is sometimes deemed as social cost, but at the same time, it also is a contributor to the platform of healthy growth and social economic stability of the community, and therefore this should be positioned as investment towards the future. Thus, we must maintain the provision of necessary services to sustain fair access and free access, and to inject further efforts to make robust healthcare system that would deliver high quality and efficient healthcare services. Through many years, we have accumulated expertise and have endeavored to make robust our healthcare system in such areas as maternal child health or health worker training and communicable diseases. And on those fronts, we've collaborated with such organs as the World Bank, WHO, and UNAIDS, and have contributed to the regime design of healthcare systems in developing nations as well as human resources development. In recent years, there is even stronger and closer linkage between what goes on the global front and domestic measures. In other words, contribution to the global society and protecting the lives of the Japanese citizens have become closer and are forming two sides of the same coin. And universal coverage, aging of the society, lifestyle diseases, are some of the areas that is attracting attention in the global health. Japan has much experience and achievements in these areas. We are therefore confident that we can make very important contributions to such deliberations. And that is why we are most happy that the worldwide authority and wisdom gathered here in Tokyo to conduct such meaningful discussion. We are one of the most advanced nations in terms of aging society, and we hope that we can contribute in terms of soft power to upgrade the level of global health care as well as public sanitation. Last but not least, I would like to extend my deepest appreciations to the ministers that were kind enough to participate in this event, as well as the speakers and panelists and participants. I also would like to extend my deepest gratitude to the Ministry of Finance as well as the World Bank, who organized this important event, and especially to those who have traveled afar from outside of Japan. Your stay in Tokyo is probably very short, but please also take this opportunity to encounter the Japanese culture so that your stay in Japan will be even more fruitful. Once again, thank you very much.
Thank you. Now I would like to ask Tim Evans to come up and make some final remarks.
Thank you very much. It's been a great 2 days. There have been well over 30 presentations and inputs, both through the technical discussions yesterday and the reporting back on the case studies, and today looking more at some of the policy implications of how we move forward. And I think for all of us who have had the opportunity to attend, it's really been a veritable feast, and one there I think we leave Tokyo feeling more clear about this agenda, more committed to following up, and I think very importantly with a considerable humility with respect to the need to invest in learning and know-how in addition to understanding better what works and where. I think that it is important to remind ourselves that despite the complexity of moving forward with these sorts of reforms, there is a tremendous amount of consensus. The values that underlie universal health coverage are widely shared across all systems. The sense of an entitlement to health, the right to health, the equitable distribution of health and opportunity to access health care are things that mobilize and are shared across countries. And we see this in the way in which these reforms gain center stage in the health discourse in so many countries. These values, though, require translation, and they get translated through concepts. And as Joe Cutson reminded us yesterday, these concepts are not what differs across country. These concepts are unifying. They're universal. How we implement them differs, but in fact we find those same concepts in the translation of these values similar across countries. Translating the concepts demands measures, and these measures too have global public good dimensions. The way in which we give attention and detail to what constitutes financial protection or what constitutes effective coverage to quality services according to need are things where we can generate considerable consensus and then tailor to context based on specific epidemiologic, demographic, economic, contextual need. We also, though, I think, have to look with that same sense of global public goods on what it is that works and what it is that doesn't work. And here I worry a little bit that there's an underlying sense that we've got that figured out. And my view is listening over the last 2 days, which is the challenges of economies that have high degrees of informal sector workers, have relatively weak fiscal capacity, that those contexts are not ones where we've got a toolbox of ready-made solutions that allow us to say, actually, this is what you should do. In that regard, I think we need to invest in testing those in a much more empirically rigorous way to see, in fact, how we can answer the questions that were put towards us by the ministers this morning, can stand up to the scrutiny of measures of evidence which would allow us to say, in fact, we know that these things work or these things don't work in specific contexts. But assuming we take that on, we get to the even bigger challenge. And this is what Julio Frank refers to rather elegantly as either the black box or the black hole of health systems. Because once you know what you want to do, you have to figure out how to implement it. And this meeting has focused very strongly on the issue of leadership and political economy, because it is about taking decisions, it is about generating consensus, it is about structuring systems, it's the roles, it's the responsibilities, it's the rules, it's the regulations, and it's about who participates. And actually implementing that and all of the consequent programs that derive from that sort of leadership and policy process is extremely complicated. And that's where the know-how in implementation becomes incredibly important. But let's say we figure that out. Then we have to ask another question. Even if we're implementing what we know works according to the concepts and values that are the effective translation of universal health coverage, are we having the intended effects? And this is also very humbling because sometimes we do what's prescribed and we implement it effectively, but we find, much to our chagrin, that in fact, according to the metrics by which we would assess progress, it hasn't been as effective as we might expect. And this requires honest, independent evaluation to allow us to understand whether those factors are coming from within the system or whether there are exogenous factors which relate to the broader context that we obviously don't control, but we know has a major impact on everything that's done in the health sector. So, all of that, in my mind, is a very simple way of sort of thinking about, in moving forward, we really have to continue with what I think is a prevailing spirit that I've seen in this meeting, which is that humility to ask the questions about what it is we know and don't know, and that commitment to invest in generating more knowledge so that we can be more effective in translating these values for the benefit of the populations that we're here to serve. So with that, I'd like to thank, first of all, the Honorable Minister of Health, Welfare and Labor from the Government of Japan for his closing remarks. I'd like to extend that to the Honorable Ministers who have traveled a huge distance at a huge opportunity cost, shared with us their insights, their particular situations, but also their comments and questions, which I think have been of enormous value to all of us, at of course, some considerable opportunity cost because their health systems don't stop while they're here in Tokyo. So thank you very much for your attendance. I'd also like to extend, in a similar way, my appreciation for all of the participants who have come and again traveled far, taken time off from their other responsibilities and participated in such a significant way over the last 2 days. Much appreciated by those of us who've been involved in the organization. And we hope, too, that you'll take as much as I think we all have from this meeting, and it'll be helpful for you as you move forward. Thank you. None of this would have happened were it not for the foresight of the government of Japan, and I think we're lucky in many respects to have not only a financier, but really a development partner that is not afraid to actually pioneer critical issues in the spirit that this one is being pioneered, and in the spirit which I think is consistent with the leadership that has been characterized by this country on so many important issues in global health. So I'd like to recognize the government of Japan for their support of this effort. We're here when it comes to implementation, because of the hard work of secretariats and people whose attention to detail is much better than my own. I'd like to recognize the JCIE that has really been the backbone of making sure that the logistics, the emails, the documents, the setups, etc., ran smoothly. I think none of us are leaving malnourished, to the contrary, and that nourishment has been not only physical, it's also been intellectual, and that's been facilitated by our JCIE partners. Thank you. Finally, on a very selfish note, I'd just like to note my own colleagues at the World Bank who've been working on this much longer than I have. I've only arrived at the bank about five months ago, and so I came in for the easy part of this whole exercise. 99% of the work had been done, so I just think there's a huge amount of work that goes into orchestrating this sort of study. We've had an excellent collaboration all the way along with the government of Japan, but day to day, there have been a group of people who have been relentless in their effort to try and squeeze the most out of this effort, and I think they've done a fantastic job. So thank you very much for that. So with that, again, thanks to everybody. Safe journeys back to your homes and your families, and all the best.
I hope you will all join us, stay here for a little bit longer, and join us next door for a cocktail reception to celebrate a very successful day. Thank you.